Hello everyone, this is Shalin Joseph and I'm presenting the competencies of advanced practice nurse. Advanced practice nurse is defined by 7 core competencies. They are direct clinical practice, which is the central core competency, guidance and coaching, consultation, evidence-based practice, leadership, collaboration, ethical decision making. The advanced practice nurse role I chose is acute care nurse practitioner, and I will be discussing 4 of the core competencies. To begin with, let's look into the role of advanced care nurse practitioner. Advanced care nurse practitioner assess and manage acutely ill patients in a variety of specialized units within the hospital and beyond, in emergency room, trauma units, intensive care units, acute or subacute ward, specialty clinics, as in nephrology, neurology, cardiology. The population they focus is adults, and they include all the spectrum of adults, which is young, middle, older, including the frail, elderly. Daily direct care activities performed by the advanced practice nurse. Direct care activity is one of the 6 core competencies of advanced practice nurse, and this is attributed as a central competency as majority of the practice time is spent on direct care. And direct care activities refers to activities and functions that the advanced practice nurse perform within the patient-nurse interaction. So moving on to the daily direct care activities performed by the acute care nurse practitioner. The direct care activities performed by acute care nurse practitioner are similar to other advanced practice nurse, which is patient assessment, critical thinking, diagnostic reasoning, ordering, performing, supervising, and interpreting laboratory, imaging, and diagnostic studies, and prescribing medications. So the direct care activities of acute care nurse practitioners is broadly categorized into diagnosing and managing disease and promotion and protection of health. So let's talk about diagnosing and managing disease. The direct activity in diagnosing and managing diseases begins with initial interaction with the patient and continues until the discharge of the patient. So the management of the disease initially begins with taking health history, which includes a detailed history of the presenting complaints and any other past medical history the patient might have, the family history, social history. Basically, health history is data gathering related to the acute disease. And after the health history taking, the next step is comprehensive and focused physical examination. And if the patient is unstable, you skip the health history and you go into the focused physical examination. Based on the history and physical examination, you arrive at a diagnosis or a differential diagnosis that you may have. And once the diagnosis is made, the next step is the intervention for the management of the acute disease, which includes ordering labs or diagnostic studies to confirm the diagnosis or look for a diagnosis. And then once the and after the lab and the diagnostic studies are done, the next would be prescribing the medication. And all these therapeutic interventions are aimed at stabilizing the patient condition. So once the patient is stabilized, the diagnosis has been made, the next thing is the patient needs to be monitored continuously, and if there's any change in the medical condition of the patient, then the plan of care will also change accordingly. Apart from these direct care activities, the advanced care nurse practitioner can also perform invasive procedure such as endotracheal intubation, central line placement, chest tube insertion, etc. Based on the institution policy and the expertise level of the advanced care nurse practitioner, they can perform these invasive procedures either independently or in collaboration with other healthcare providers. Maybe the institutional policy will be the initial invasive procedures performed by the acute care nurse practitioner must be monitored or collaborated with other healthcare providers, and once they gain experience and skill in performing the procedure, they will be able to perform it independently. The other direct care activity in managing the disease is collaboration with other healthcare providers, which is also a core competency, and I'll be discussing about it later in the presentation. Okay, the second category in promoting and protecting health and preventing disease is recognizing health problems for which the acutely or critically ill patients are at risk for during the inpatient stay. So the nurse practitioner recognizes the health problems and all the risk factors that the patient may have or may acquire during the stay, during the inpatient stay. So the nurse practitioners recognize it, and they implement strategies to prevent the risk factors. Example here would be during an inpatient stay, the patient is immobilized and the patient is at risk for developing pressure ulcers. So the acute care nurse practitioner is aware of the risk factors and takes steps to prevent the formation of these pressure ulcers. Other activity for promoting and protecting health is counseling to the patient and the family. In the inpatient setting or in the acute care setting, the patient as well as the family members have various needs and various questions and concerns. The acute care nurse practitioner will be able to answer the questions of the patient and attend to the needs of the patient. And doing so, she will be promoting and protecting health in the acute care setting. The next competency is collaboration. Successful patient outcome in an acute care setting depends on the collaborative effort of multidisciplinary healthcare team. In an acute care setting, there is a need for ongoing continuous monitoring. So they require, with this kind of setting, collaboration with other multidisciplinary healthcare team will make it possible to go for the ongoing monitor proceed smoothly. So most frequently, the collaboration of the acute care nurse practitioner is with the physician. So collaborative practice between the nurse practitioner and physicians can expand the range and availability of services to the patient. So the patient is given more attention, and the healthcare needs of the patient is taken care by the nurse practitioner as well as the physician. So which in turn will result in a positive patient outcome because all the healthcare needs are met. The next competency is guidance and coaching patients. Providing guidance and coaching to patient family members and other healthcare providers is an essential part of acute care nurse practitioner care. Due to complexity of the illness and involvement of multidisciplinary team, educating the patient as well as other healthcare providers regarding the plan of care and disease process is important for positive patient outcome and it's important for the positive outcome of the patient. During in hospital stay, the patient and the family members will have again, as I mentioned in the previous slide, where they'll have questions and concerns about their disease. So in order to attend to these needs, the acute care nurse practitioner will have to give education about the disease process and the treatment, the plan of care for them. So the patient is involved in the care. Basically, if you involve the patient in the care, like making choices for his treatment or giving education about his disease process, if the patient is involved, the outcome is better. Guidance and coaching is in guidance and coaching is an health promotion and disease prevention source while discharging the patient. During discharge, and the patient has just recovered from acute illness, will be more receptive to guidance and coaching. Here an example like can cite is if we have a patient, diabetic patient who has been admitted with uncontrolled diabetes with hyperglycemia and complication from diabetes, he will be more receptive at this he or she will be more receptive at this point when you educate about medication compliance. So and since the acute care nurse practitioner has a very narrow window of patient interaction, it is advisable that they make use of the most opportunity that they get and provide education, and at this point the patient is also receptive. And also some patients after discharge may not follow up with the primary care physician, and so the acute care nurse practitioner education and coaching will be very valuable in this case. The next competency is leadership role. Acute care nurse practitioner assume advanced leadership role to initiate and guide change. They provide guidance, consultation, mentorship, educational experiences to students, nurses, and other health professionals regarding acute and critical care population. Coordination of care between multidisciplinary healthcare team. The acute care nurse practitioner assume leadership role in coordination of care, since they possess skills to effective communication between members of the healthcare team in rapidly changing patient condition. So their leadership role here is very valuable because since they coordinate care, the patient receives timely services, and their leadership in delivering the care to the acute changing condition of the patient is valuable. And they assume leadership position in professional, political, or regulatory organization. By doing so, they are able to influence healthcare policy, advocate on behalf of the populations they serve, and they also promote access of care to the population they serve. These are some of the competencies of an acute care nurse practitioner possess. In United States, there's rapid increase of critically ill patient, and corresponding critical care health provider are unable to meet the needs of these critically ill patient. So acute care nurse practitioner are uniquely suited to cover the gap in the critical care. That's the end of my presentation. Thank you everyone for listening to my presentation. Thank you.